Notice: the images of individuals appearing in this video serve solely for illustrative purposes. They may not represent actual doctors or patients. Thank you. Night eating syndrome, NS, is a complex eating disorder characterized by a delayed circadian pattern of food intake. Unlike other eating disorders that are primarily concerned with the amount and type of food consumed, NES focuses on the timing of food intake. People with NES consume a significant portion of their daily calorie intake during the night, particularly after dinner, and this pattern often leads to problems with sleep. NES was first identified by Dr. Albert Stunkard in 1955 and has since been recognized as a distinct eating disorder. It is often associated with other mental health conditions, such as depression, anxiety, and stress. The prevalence of NES varies, but it is estimated to affect 1–2% of the general population and is more common in individuals seeking treatment for obesity or weight-related issues. The key characteristics of NES include evening hyperphagia, a significant consumption of the day's calories after the evening meal. Individuals with NES often report that they are not particularly hungry during the day, but experience strong cravings for food at night. Night awakenings with eating. Frequent awakenings from sleep accompanied by compulsive eating. These episodes are not the same as sleepwalking, as individuals are fully conscious and remember eating the next day. Morning anorexia, lack of appetite in the morning. People with NES often skip breakfast or eat very little in the early part of the day. Mood and sleep disturbances. People with NES often experience mood disorders, such as depression and anxiety. Poor sleep quality, including difficulty falling asleep and maintaining sleep, is also common. The cause of NES is not entirely understood, but it is believed to be a combination of genetic, psychological, and environmental factors. Hormonal imbalances, particularly involving the hormones leptin and ghrelin, which regulate hunger and satiety, have also been implicated in NES. Stress, lifestyle, and eating habits may contribute to the development of this condition. Diagnosing NES can be challenging as it shares symptoms with other eating disorders, sleep disorders, and mood disorders. Diagnosis typically involves a thorough assessment of eating patterns, sleep evaluation, and psychological screening. Treatment for NES is multifaceted and personalized. It may include cognitive behavioral therapy, CBT. This is often the first line of treatment, focusing on changing eating patterns and addressing the underlying emotional and cognitive issues. Medication. In some cases, medications that regulate mood or appetite may be used. Lifestyle changes. Establishing regular eating patterns, improving sleep hygiene, and incorporating stress reduction techniques can be beneficial. Nutritional counseling. Guidance on balanced eating habits can help redistribute calorie intake more evenly throughout the day. Living with NES can be challenging, impacting both physical health and emotional well-being. However, with appropriate treatment, individuals can manage their symptoms and improve their quality of life. As awareness of NES increases, more effective and targeted treatments are likely to be developed, offering hope to those affected by this complex disorder.